Hi, I'm Dr. Tania Dempsey here at the Ames Center for Personalized Medicine. I'm here with Dr. Colin Renaud, our new physician's assistant, and we're here today to talk to you about COVID and COVID vaccines and lots of other things. Colin, why don't you tell us
Lots of good stuff.
tell us about yourself.
So yes, I'm new to the practice. I've been here. How long have I been here? Since November of last year. I have a background in alternative and medical disciplines. My primary focus is functional medicine, regenerative therapies. So I'm loving the practice so far, and we've been doing a lot more now that I'm here. So it's great.
It's been great.
But Dr. Dempsey and I wanted to come on and talk a lot about COVID. Because we're getting a lot of questions about the vaccine and people's hesitancy and what they're seeing in the media and questions that people have. So we thought we would talk a little bit about some of the things that we see. So one of the big things, Dr. Dempsey, that I notice from patients that I've been getting questions on is sort of confusion in the media.
Yeah.
So one of the big things, and I've had this conversation maybe 3 or 4 times in the last week, is people are confused about why people are still testing positive for COVID, yet they're vaccinated.
Mm-hmm.
So the media is sort of, with the Olympics going on and people traveling, it's like, how are so many positive cases coming out of this when supposedly the vaccine was supposed to not have this not happen? So what are your thoughts?
You know, it's an excellent question, and I think, the way to really think about this is really look at the numbers, right? So we're talking about millions of people vaccinated.
Right.
We're hearing cases of breakthrough infection.
Right.
That's inevitable, actually, because no vaccine is 100% effective, right? We're looking at a vaccine that we hope is 80% effective,
right?
Maybe 85, 90, but it's not 100, right? So you're always going to have people who are going to get infection, especially if there are unvaccinated people in the community.
Right, and that's the big thing.
And I think that's a big thing, and that's why we want to talk today, because I think that, in New York, 50-50, 50% vaccinated, slightly maybe over 50% vaccinated.
Yeah. Well, I know the national threshold just reached 70%. It was just published, I think yesterday or the day before, they have at least one shot. And that was the goal, I know, with the new White House administration, was at least 70% to get some sort of herd immunity. So, the 50, I don't know where we are in New York State.
In New York State, I want to say it was like 58%. I just looked at the statistics the other day. So it's good, but it's not perfect, right? So as long as there are plenty of unvaccinated patients, it's inevitable that both unvaccinated and vaccinated patients are going to get the virus, and that's definitely concerning, and it's definitely it's disconcerting on some level, right? Because you think, well, we went through all this trouble, and I think it's discouraging for people who are unvaccinated, because they think, well, what is the point anyway?
Right, why should I bother?
But I think that that's not the right approach. I think we can't think that way.
Yeah, my approach, and what I've been talking to patients with, and I had a great conversation with a patient the other day, is sort of the idea behind the vaccine, and sort of the big picture goal is not that you won't get COVID or that you won't be exposed, but really at the end of the day is we don't want people to die. We don't want people to go in the hospital. We don't want people on ventilators. We don't want people sort of taking over the health system again, what we saw last year. So if people are getting COVID, mild illness, if they hadn't received the shot, maybe it would have been a more severe illness.
Correct.
And that's the point, is you're not 100% immune. It's maybe you will test positive, but you're still maybe asymptomatic or mildly symptomatic. And that's really the goal. I think that's sort of that's my big message to patients is we don't want you to pass away. We don't want to have big negative complications. So I think that's one, and that brings me to my next point, is sort of, what is the goal of the vaccine? What's the big picture, right? So that's how I think of it. I don't know if you have any more thoughts about that.
Yeah, I'll just reemphasize that fact that there is, we're trying to prevent severe infection.
Right.
We ideally would love to prevent infection.
Correct. Right. But that just doesn't work that way.
It doesn't.
Right.
And even we look at other vaccines like the flu vaccine.
Exactly.
It's never 100%.
Right.
But the flu doesn't carry the same dangers although it does carry danger. I mean, people don't understand that people die from the flu too.
Right.
There's different percentages, right,
Right.
compared to COVID. And so again, no vaccine can be 100%. We have patients who have immunocompromised immune systems, right? They may not. They may not react to the vaccine. They may not have a robust immune response to the vaccine, and so they may still be susceptible, right? But again, having mild COVID, maybe preventing long haul COVID, which is a conversation that I think we're going to get into as well.
We'll have that another day. Yes.
We have to definitely cover that because I think that's a critical piece and a big part of our practice.
We see it every day. Yeah.
So maybe the vaccine prevents long COVID, right? And look at all these people who were sick during the first wave back in February, March of 2020. Some of them still sick. Right, we hope that the vaccine will prevent that in this next round.
Right.
And then ultimately, of course, we're trying to prevent death.
Right.
But
and just overwhelming the healthcare system. You know, I mean, we don't work in acute or emergent care, but when we have colleagues that do, I know plenty of people that do, and that's the big thing is, there's only X number of ICU beds per X number of people in a population, and that's where people get afraid. So. I think that's the big take home, especially for me. That's one of my big things. So I know one of the other big things that we talk about all the time with patients is sort of some adverse effects, risks. Should I be worried? There's been these pop-up things about some adverse effects that we've seen in the adolescent population. And what should we be concerned? Are you concerned? Are we concerned?
So again, it goes back to risk-benefit.
Right. Yeah.
Everything you put in your body. From a Tylenol
to food to the clothes you wear, right?
There is, potentially. Yeah. There is always a risk, right? Yeah. So there's never going to be a vaccine, a medication, a treatment that doesn't carry some risk, some potential for adverse effects, right?
Correct. Yeah.
So it's unfortunate that there have been people who have had serious side effects from the vaccine. We've heard that from the J&J with blood clotting. We've heard about the myocarditis in the adolescents, and particularly adolescent boys, which is inflammation of the heart from Pfizer. But there are probably again there are other side effects as well that have been shown, but. Again, we're talking small numbers, millions of people vaccinated, small number of people with side effects. And again, I think you have to weigh risk benefit. So what is the risk to you of getting COVID?
Right. Where do you live? What kind of people are you around?
And what is your health condition? And what is your susceptibility?
Right.
And
what is your susceptibility to give it to someone else?
Yeah. Good point.
An elderly relative or a spouse that's immunocompromised or a child or whatever, right?
But the point is too that if you get COVID, what is that? What is the potential risk, right? Look at all the long-term consequences that we're seeing from COVID, the virus, right? We have seen tremendous issues with neurologic conditions, postural orthostatic tachycardia syndrome, or POTS, which is a very big part of our practice here, where we do a lot of, treating patients with the trifecta of mast cell activation syndrome, POTS, and EDS. Yes. Now we're seeing this tremendous uptick in the COVID, post-COVID population.
Right.
There are numerous instances of autoimmune diseases popping up after COVID, potentially heart damage. So the myocarditis that we saw with a lot of inflammation and lung damage and people needing lung transplants. I mean, the list goes on, right?
Yeah. So
what is is the risk of getting COVID worse? Right? And I would argue it is worse than getting the vaccine. Yeah. But look, everybody has to weigh the risk benefits for themselves, right? So we're sitting here, we're talking about this because we feel very strongly that people need to be vaccinated. That is our message, okay? That we're in an integrative practice. Yeah. We are holistic to some extent, right? To many extents. But we believe in the safety of our patients, right? But every single patient has to talk to their physician and weigh the risk and benefit.
Everybody's
not everyone can receive the vaccine. We understand that. There are allergens, in the vaccine, like PEG, which some people are allergic to, they can't get the vaccine, right?
Right.
We're not talking about those. We're talking about instances where people are choosing not to get the vaccine because
Right.
of fear.
Right.
And what we want to do is we want to try to alleviate the fear,
Right.
and help people to understand that
Just have a dialogue.
you have to
Yeah.
talk to
Yeah.
your providers and figure out what's right for you,
Right.
and what the risk benefit ratio is for you personally.
Right.
I had COVID in January.
Yes. Yes.
And a lot. Some people know. I don't know if everyone knows, but I was quite ill. I was in the hospital for 5 days.
It was a tough time. Yeah.
It was scary as hell. And I just would never want anyone to experience what I experienced, and I certainly don't want to experience that again.
Right.
And I'm scared. I'll be honest.
Yeah.
Right. And who wouldn't be if you go through that? So I feel stronger than ever that now
Right.
is the time that we have to protect.
Right. And a lot of people are fearful now because of the Delta, these sort of new variants, and I want to talk a little bit about that. Sort of, what is that? What does that mean?
Yeah.
What is a variant? What is Delta? Is it worse? Is it whatever? And I know that there's new literature that was just released saying that it's more contagious than the chickenpox. So it's even, but there's also a confusing literature from the media saying, well, maybe these vaccines aren't good for the variants. So maybe should we not? So that's the biggest confusion. So what's your response to that? What would you say?
So, yeah, well, there's no easy answer.
Right, that's the thing.
I will say that I think that the research, the evidence is very compelling. That this virus, the Delta variant of the virus, right? So we're talking about slight genetic changes, right?
It's in the population for a certain amount of time.
It's going
Right.
to, viruses mutate.
Right.
It's sort of like with the flu.
Yeah.
Every year there are different strains that go around, and they try to match the flu vaccine to what's happening, in the season before in the southern hemisphere, let's say.
Yeah.
So the point is that viruses mutate, and COVID has mutated, and we're now up to this Delta variant.
Yeah.
I believe that the initial variant was Alpha. I think
I'm not
that
sure.
was the original one.
Yeah.
And again, it's gone through a series of different mutations. So.
Right.
The mutation now is more virulent. It's more contagious, and probably more severe. We're starting to see is that it's infecting younger people than the other variants.
Yeah.
That's obviously very, very concerning. And so that's the issue with Delta.
Right.
The question is about these vaccines.
Yeah.
And we don't have a vaccine to match Delta.
Right.
We hope that the technology will be there, like we have with the flu, where we can match the strain of the flu.
Right.
Maybe we'll be able to match the vaccine with that virus.
Yeah.
We're not there yet.
Right.
But having an immune response, right, that has seen the virus, right, through the vaccine, I think is being shown as helpful.
Yeah.
Is it going to be 80% effective for Delta? We don't know.
It's better than nothing at this point. And again,
Exactly.
as we've reiterated, it's one of those things where you don't want to take the risk of is it Delta, is it not? Well, maybe if I get sick, it's going to be Delta, so I might as well not. It's not that simple. And the biggest thing too to remember is that we just we're trying so hard to keep the virus out of the population, and that's how variants occur. Is the longer they can live, the more time they have to mutate. So, that's another big question. Will there be more variants? Well, we don't know that yet either. We're just trying so hard to prevent new ones. So I think this brings us to one of my last things I want to discuss with you, Dr. Dempsey, is masks. I know that's a big thing that we should talk about, and I have a lot of questions about that. So, people are still wearing masks. Should we wear masks? Should vaccinated patients wear masks? Should we not? I have some opinions.
So please share with us.
So things I've said.
Yeah.
I'm definitely still one of those people that goes through. I'm vaccinated, been vaccinated, I think since March or something. Yeah. But I still wear a mask in the grocery store because it's a populated area, and as a healthcare provider, maybe if I wasn't, maybe if I worked from home, or maybe if I had a different life than I do as a healthcare provider, I wouldn't maybe be as cautious. But when I go to the grocery store, go to Target, go wherever, I do wear it just because I feel like it's the right thing to do. And I'm not trying to make a statement. I'm just trying to do the right thing. And I think that's really at the end of the day. So my personal thing is if you've been vaccinated and you're in a populous area, say you're traveling, go to the airport, you go to the mall, it's not gonna hurt anybody. It's certainly not gonna hurt you. It's not gonna hurt anybody around you to just be extra cautious.
Right.
Because again, one of the big take-home messages about COVID and being vaccinated is it's not necessarily all about your risk. It's about what you may pass to someone else.
Good point.
If you're exposed, if you do get exposed in the mall, and then you go visit your elderly grandmother, and she's immune compromised, you don't know how that is going to work. So I think that's just something to remember, is that it's not necessarily about you, it's just about doing the safest thing. That's how I look at it. I don't know what your thoughts are.
Absolutely. I'm the same way. I'm risk averse. So,
right.
So, and I've already had COVID, so I wear, double mask everywhere. But here's the thing, right? What I've heard, one of the arguments I've heard against wearing masks is that masks are not effective, which I want to, talk about.
Right.
And that, the reason, so this is what I've heard from some people, the reason I got vaccinated
so I don't have to wear a mask.
So I don't have to wear a mask, so that I can go on with my life, right?
So I want to wear my lipstick and my,
Exactly. But and here's the thing, I understand that.
Right,
and,
right.
This has been a long journey with this virus, right? We're all tired of it. It's scary, and it's tiring to be in constant fear.
Yeah.
But at the same time, again, we're talking about protecting others, right? And this is the time we've got to remember it's not about selfishness, it's about selflessness.
Right.
So I'm going to wear the mask to protect others. I'm with patients, yes, I'm double masked and I'm protected, and I'm vaccinated, but I don't know if I could potentially carry it. So I'm going to wear a mask because I want to protect others.
Right.
So the mask may be effective, is effective, okay? It does cut down on transmission of the aerosols, right? Is it 100%? No. But it's pretty good, and it's better than nothing, right? I also know with the mask that if I wear the right type of mask, I am going to prevent myself from breathing in too many aerosols, right? We're talking about cutting down on the load of virus.
Right.
Without a mask, more load, people, breathing in the air, the aerosols are going all over. With the mask, I'm going to cut down on what I get. I'm going to cut down what other people are getting.
100%. Nothing's 100%.
But nothing, right? And I think that's the point. That I think the take-home message is, we're just trying to mitigate risk. We're trying to help.
Right.
We these are the tools we have. And there's some other things we'll obviously talk about as far as tools, but the reality is that I think it's just for everyone's safety and for your own. Let's just keep doing this. I know it's the long road here, and we don't know, we're in this for a while. I think it's important for people to know that the research doesn't show that COVID is going to go away after Delta.
Right.
It's going to be here with us for a while, and but we have to learn to live with it in a safe manner. And that's my, listen, we're talking about here's opinion to some extent. We're talking about research and science, okay?
And what we see, our clinical perspective too.
Yeah. And listen, some of it can change over time, and I want our audience to know that. And
it has. We've changed our mind 50 times since this started, every day.
Probably because we learned something new.
Right.
This is a new virus. We've not seen anything like this in our lifetimes, or in several lifetimes, right? Several generations. So we are learning, right? And I think that is the other frustrating thing that I hear from patients is, why can't the government, why can't doctors get it right?
Why can't we have the answers?
Because we can't, because we don't know enough. We've only had this virus for what, year and a half.
The doctors in the out there seeing patients, and the government or the CDC, whomever you want to talk about, is creating and enforcing different things. But at the end of the day, some of these sort of common sense things about wearing a mask, should you not, it's one of those things where you just kind of, the right answer is just what we think is right.
Correct.
As a human, period. It's, is there science? Yes, but it's sort of we're all in this together, just trying to do the right thing. I think that's maybe the take home. That's how I look at it.
Yeah.
That's my big take home.
Yeah, I agree.
So any other thoughts, last minute wrap ups before we say goodbye to everybody?
Well, I guess, look, I want everyone to keep themselves healthy. I mentioned, I said, we'll talk about some tools. Look, get enough sleep.
Yep.
What do you do to help your immune system?
Right.
Again, nothing is 100%, but you get
Be
your
proactive.
Sleep.
Nothing wrong with that.
Yeah. Get enough sleep.
Yep.
Try to reduce your stress.
Try.
Eat healthy, right?
Well,
Try to stay away from sugar and things that are not good for the immune system and lower the immune system. In our practice, we do prescribe supplements and vitamins. For some patients, they're helpful. Again, they're not gonna. I don't think they can prevent infection with COVID, but I think that they can be helpful in boosting the immune system.
Yep.
And so that's
who doesn't need that?
Yeah.
Right. So it's
vitamin C, vitamin D. Vitamin D is probably like the number one.
I think that's my number one.
Number one, right? And so at this point, everyone needs vitamin D, and so that's kind of the take home for me is try to stay healthy, be proactive, like you said.
Yep.
Consider the vaccine, talk to your healthcare provider, and
think about others
wear masks
too. Think about what it means to not only you, but what it means to your spouse, your children, your family. What does that mean? Consider, because like you said, it's not a one person thing. This is affecting the whole world. It's not like it's an American thing or whatever. This is a global thing, and we all sort of have to think about that in a way. So.
And to that point, one other last message that I think is important is that because so many people are tired of this pandemic, we have people who are traveling, they're trying to get on with their lives, and unfortunately, that's what's helping to spread the virus. So it's about just being thoughtful and understanding again risk benefit for everything you do. And it's unfortunate that we're in this situation, but it's our reality. So that's what we deal with.
So we'll keep thinking about it, talking about it, sharing thoughts. This has been fun. I'm glad we did this. I hope some people out there learn some things, and we'll do more. We'll talk more.
Yeah, I think our next one, we definitely need to talk about long COVID.
Okay.
I've already got it. And you know what? Well, I'd love to hear what other people, as
what
you're
other
watching the
people
video,
think.
what you think about us, what topics you want to hear about.
Comments, feedbacks, we'd love to talk. So. Well, it's been a pleasure. Thanks for everybody that's watched. You'll see more of me because, like I said, I'm new to the practice, so this has been fun. So signing off, I'm Dr. Renaud with Dr. Dempsey. We'll see you guys next time.
Take care.
Bye-bye.
Bye. Stay safe.